Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this show, I check the temperature of public health in the United States and around the world, and I give you expert insights on infectious diseases and public health. Today, I want to speak directly to parents, parents like me. You're holding your infant in your arms, you're scrolling through the headlines, and you're asking one question that matters most right now. Is it safe to take my baby outside? Now, that answer used to be pretty simple, but this is 2025. Measles is back. It's spreading and it's potentially deadly to your baby. So, what's happening right now? Since the start of this year, there's a single outbreak in West Texas has ignited a national wildfire, an epidemic of measles that has spread to 19 states. As of last week, there are 483 confirmed measles cases, and that number is growing. And that's just what we know from laboratory tests and contact tracing. The real number, it's probably much higher than that. So far, 70 people have been hospitalized, and as of last week, 2 children have now died. That was the first measles death in a decade, the first time it happened, and now we have 2 of them. I've spent over 20 years in public health, working on outbreaks across the globe. What's happening in the US right now? It's not just alarming, it's a preventable crisis. Measles, as I've told people before, is not just some mild childhood illness. It's one of the most contagious diseases on the planet. A single infected person can pass it to 90% around people around them if they're not immune. It hangs in the air for hours, meaning your baby could be exposed in a pediatrician's waiting room or in an airport, even if a sick person left long ago. And so just a reminder about what's at stake. Measles can cause pneumonia, deafness, blindness, and encephalitis, which is a swelling of the brain that can be fatal and leave lasting damage. And even when children recover, measles can leave behind something insidious. It damages the immune system, erasing protection from infections you've already had or been vaccinated against. It's a condition called immune amnesia. And there are even some rare cases, especially if your child was infected before the age of 2, where the measles virus triggers a devastating condition called SSPE, subacute sclerosing panencephalitis, that appears years, almost 10 years after your original infection. And that condition is fatal. And as a reminder, there is no cure for this virus. There's only prevention. So now let's talk about whether it's safe to take your baby out and why we have the vaccine schedule that we do. So when we think about infants in the United States, we give the first dose of the measles vaccine. It comes in a package of 3 vaccines: measles, mumps, and rubella, or MMR. And we usually give that. The recommendation is sometime at the age of 1 or up to 15 months of age. So why did experts pick 12 months? Because until then, babies carry antibodies from their mother. These antibodies protect them for the first few months of their life, but they stay on for a little bit longer at lower levels that can then interfere with the vaccine's effectiveness. So from like a public health policy perspective, from a doctor's perspective, there's a tricky window. If you vaccinate a baby too early, the shot might not work as well and may not protect them as much for the future. But if you wait too long, you vaccinate too late, your baby is vulnerable. They're at risk of measles. So for decades, however, this wasn't really a major concern in the US because community vaccination rates were high. That herd immunity, that we call it, acted like a protective shield around every baby. So even if they weren't immune to measles between 6 months and a year old, they had the protection of the community. But that protective shield, it's now cracking. So is it possible to have your baby vaccinated earlier than 1 year of age? And the answer is very straightforward. Yes, you can. In the context of an outbreak, both CDC and the World Health Organization agree babies should receive an early dose of the MMR vaccine as early as 6 months of age. And this isn't just some new science. It's a standard practice in countries where measles is more common and more likely to cause severe illness. And study after study have shown that it's safe. But there is one catch. that early dose doesn't count toward your regular vaccine series because the immunity that you get between 6 months and 12 months of age may not last. So your child will still need to get 2 more doses, one after they're 12 months of age and another at 4 to 6 years of age. Is it safe for them to get 3 vaccine doses? Absolutely. Extra doses do not pose any risk. And in a high exposure situation, like we're starting to get to right now in parts of the country, that could make all the difference. Now, some people are probably wondering, well, there's got to be a test out there. There's got to be some way I can test my baby after that early dose. Let's say I get my baby vaccinated between 6 months and a year old. Can I get him tested so we know if the vaccine took or whether or not I need those 2 extra doses? Unfortunately, the answer is no. There are, yes, special tests that can be done, but these can really only be done in research labs that they look at a very particular type of antibody called high avidity antibodies, or they look at special ways that your immune system's T cells work. But those tests are not really available in regular laboratories. They're only available in very specialized research laboratories. And even if you have those tests done, they aren't really reliable enough right now for us to guide decisions about our own health. So the safest path, the one that I recommend, is treat that early dose that you might get between 6 months and 11 months of age as a bridge, a temporary pathway until your baby is old enough to mount a stronger and longer lasting response. So what are the things you should be thinking about? Should you vaccinate your baby before 12 months of age against measles? There are 3 key factors to think about. The first is about your location and travel plans. Are you in a place where there are active measles cases, or are you planning to travel to one? Number 2, are there other kids vaccinated in your community? What is the vaccination rate in your community? Are your daycare, neighborhood, or family circles filled with people who are vaccinated or not? The third is your baby's age and health. Is your baby between 6 and 11 months old? And if they are, talk to your pediatrician. Babies under 6 months old can't be vaccinated yet, so their best defense is to stay away from high-risk environments. So I want to be clear. I'm the parent of 3 kids. They're all grown up now and have gotten all their vaccines. But if I had an infant right now living in my home and I lived in an area or was traveling to a place with measles outbreaks, I would absolutely get that early dose of vaccine. We have a safe and effective vaccine. We know how to stop this virus. The reason measles is spreading in America in 2025 is simple. Not enough people are getting a safe and effective vaccine. So let me leave you with this. Every parent wants to do what's right for their child. And sometimes doing what's right means adjusting your plans. An early dose of the measles vaccine might not have been part of your plan, but this outbreak wasn't either. So talk to your pediatrician, look at the data, and consider giving your baby that extra layer of protection. If you found this video helpful, please like, subscribe, and share it with other parents or caregivers who might be struggling with this same decision. And if you want more expert insights on infectious diseases and public health, all of that without the hype, stick with my channel, Thermometer. I'm Dr. J. Varma, and thank you for joining me.